Dr. Schu here, your Jacksonville chiropractor. We have a patient in with us today, comes in with some neck pain, low back pain, from chronic disc issues. Been having a lot of radiating pain down into both arms and both legs, does a lot of CrossFit, works out a lot. He also owns his own roofing company here in Jacksonville, Big Tuna Roofing. Still staying pretty busy during this time a little bit, but has actually been coming in a lot, taking care of himself, taking this downtime to really focus in, do some self-care. So we've been working a lot with getting that neck movement, the low back moving, been doing some exercises, a lot of soft tissue work. So what we're going to do today is we're going to adjust, we'll do some soft tissue work, and then we'll do some exercise and then get him on his way. So again, appreciate you guys watching the videos. Make sure you go check out my Facebook, my Instagram, and check out the rest of my YouTube videos. A lot of good information on there. And as always, thanks for watching. So let's go ahead, let's go face down. Mark, we're going to have you up on your side facing the wall first. So keep that bottom leg straight. Just let that low back go, okay? Good. And other side. Good. So how have you been feeling since you've been coming in?
Better. A lot of the pressure's off.
Yeah.
My neck and my lower back, the SI dysfunction that I had is starting to get better, along with doing the exercises you gave me at home. I'm feeling stronger, able to actually bend over,
yeah,
and pick stuff up again.
We've seen a lot of improvement. I think the exercise has been very beneficial, but just getting motion in that low back. We've been training this low back a lot, re-educating that area to move on its own, to have an understanding of the disconnect between his lower half and his upper body, really stiffen that low back area. So with the exercises and the adjusting, we've just been re-educating of how that area should move. And he's been doing all of his exercises at home, been doing very well with them. So we've just kind of been continuing that process. He's also been having a lot of neck issues too, so we're just going to come up in the neck area here. Very gentle adjustment. Does have some, that actually has a herniation in his lower cervical spine here. Originally came in with a lot of radiating pain, but it's kind of subsided. Just relax that right shoulder for me. How's this right side doing?
Right side feels good. It's more the left.
Down here.
Yeah, more the left side.
Let's go face down. Let's get a little soft tissue work on that. So since he's been sitting around a lot lately, you know, kind of at home, doing a lot of work from home, just been having a lot of tightness in this mid back and low back. So just gonna use the Hypervolt a little bit, just kind of ease the muscle tension in there, stimulate that area a little bit. Hit a spot in there. Saw you twinge a little bit.
It's like, yeah, I'm not doing it. It's involuntary for some reason.
Yeah. So what I'm doing actually right now, during that the Hypervolt therapy, when I was running it down his back, he was getting a little twinge, and as talking to him, he said that was involuntary. And what happens a lot of times is we become hypersensitive in some different areas of that back. And what I'm doing with the pinwheel is just kind of going back through those spots and just seeing if I can't recreate that little reflex action. And we get a little bit right here at that, right where that thoracic spine meets that lumbar spine. Getting a little sensitivity right in there. You can see that skin jump a little bit. So what I'm gonna do is, a lot of times patients will be a little sensitive in that area, so don't do a whole lot of muscle scraping. But what I'll do is I'll come in with some cupping therapy. Decompress that area a little bit. Still getting some blood flow to that area. What I like to do here is just kind of move that cup up and down and just kind of go over that area, go out and in, kind of over where that nerve distributes a little bit. Getting a lot of muscle tightness on this side too when we're palpating. A lot of times that can be caused just from different things that he's been doing, the way he's been sitting at the house, sitting in the truck, going from job site to job site, different things like that. How's that feel?
Good.
Not too much for you? Good. All right, so after the adjusting, we did a little soft tissue work in that mid-back, low-back area to try to take some of the sensitivity out of that area that we were noticing when I was going through the hypervolt. After all that, how do we feel?
Better.
Better?
Much better. More relaxed.
Good. And we've kind of been noticing that same pattern. He's been coming in about once a week or so for the past few weeks, and he'll feel really, really good for 3 or 4 days. And then once he starts doing things, getting back into his habits back at home, which we've been trying to work on with the exercises, things like that, he kind of falls back into that pain pattern a little bit. So we've just trying to really been staying on top of stuff, changing up the exercises. He's been doing a great job of staying on those at the house. But when he first came in, really flared up, could barely walk into the office. So doing a lot of stuff at home now, a lot of stuff outside the office, and just getting his function back, which is great. So again, appreciate you guys checking out my videos. Make sure you check out the rest of them on YouTube. Go to my Facebook page, hit that like button, and make sure you follow me on Instagram as well. Again, Dr. Schu, your Jacksonville area chiropractor, and thank you again for watching.